So today we're going to talk about some of the top 10 misconceptions that persons still have about nursing in 2025. Hi everyone, welcome to the channel. Thank you so much for tuning in to the Fit Nursing channel, where it's all about nursing, travel and lifestyle. With any profession, especially the nursing profession, there is a lot of misconceptions about it that a lot of persons are still saying and thinking in 2025. So today we're going to talk about some of the top 10 misconceptions that persons still have about nursing in 2025. All right, and I just want to talk about it because it hurt me sometimes when I hear it. It does hurt my heart sometimes when I do hear it, and so we're just going to talk about it a little bit. All right, if you haven't subscribed to the channel though, I would love for you to go ahead and subscribe, like, share, turn your notification bell on for more content related to nursing, travel and lifestyle. All right, so the first thing is when it comes on to doctor's orders, a lot of times people always say that nurses only follow doctor's orders. So when persons talk about nurses only following doctor's orders, I would definitely say no, because we are highly trained, we're skilled professionals who, you know, we have our roles and our duties and our responsibilities when it comes on to our profession, and so we collaborate with doctors to make sure that the patient is well taken care of on a daily basis. So another thing is a lot of persons will tend to say that nursing is a joke and anybody can actually become a nurse, and I want to tell you, no, nursing takes 4 years. You have to go and sit the NCLEX, and the NCLEX is no joke. The exam in Jamaica is so difficult that, you know, I wouldn't tell anybody that it's something that you can easily walk through or you're gonna go there and just click. You have to do clinical assessment. You have to go ahead and do your hands-on procedures in the different hospitals in front of different persons from the region. So when persons say that it is a walkthrough and anybody can do it, it's not everybody can do it. You have persons who have failed the exam, had to go and resit, and still end up failing it, you know. So it's not a walkthrough and it's not for everybody. All right, it is something that you have to be trained, you have to be prepared in order for you to actually become a nurse. So when you talk about the NCLEX as well as other exams that we do in the Caribbean, such as the RENR exam, it is an evidence-based practice, you know, exam, and so it's not anybody can do it, because you have to go ahead and get the training and be able to do certain procedures, answer the questions appropriately in order for you to actually become a nurse. So another thing is that they always say nurses only work in hospitals. They work in communities, public health, they work in prisons, military bases. So there are so many different areas that nurses are working. You have persons working on YouTube as well, because look at me doing content here. I'm a nurse, I'm working as a nurse here. So you have a lot of persons who are working in different areas in society. So it's not all about bedside nursing and hospitals that is usually being portrayed when you think about nursing. So a lot of times you'll hear that nursing is only for women, and it is a no-no. Nursing is not a profession only for women. It is for both gender. So if you're male, female, feel free. As long as you have the skills, you know, you have the heart, the love, the passion to do it, and you're a critical thinker, I think this will be a good field for you. So a lot of times you hear people talk that nurses only go ahead and give medications or pass meds, or they only give shots and injections. And yes, well, you know, the profession itself, or you being a nurse, a part of the role is to administer medication. That is only about 10% of what we do as nurses, because when you talk about advocating, when you talk about saving life, and I'm not talking about, you know, just, oh yeah, we're saving your life because we're giving you Tylenol or Panadol, or we're giving you some Aleve. We're talking about pumping chest, having patients come back from the dead, you know, to being alive or having a pulse. We're talking about patients when they do come into the emergency room. Nurses are the ones that are on the front line, along with other health professionals that are saving those patients' lives. And we interpret lab results, we're advocates, we're educators. So that is something that we definitely need to kind of cross out in 2025 right now, because that's a no-no. Another thing they always say is that nurses have really, you know, easy schedule. Even though we might work 3 days a week or 40 hours per week for, you know, full-time person, a lot of times we're working under high stress. We don't have any scheduled lunch break. We don't get all the weekends off. Holidays we don't get off, you know. So it's not a case where our shifts or our schedule are easy, because we don't really get a set time off from work, except when you put in a PTO or anything like that. So for persons who say that nursing schedule are easy, that's a no-no. A lot of persons tend to say say that nurses only do the same thing, and that's another thing that we definitely need to get out of our mind, because you have some nurses who focus specifically on, you know, the elderly, pediatrics, family nurse practitioners, or you have persons who focus on emergencies. So there are so many specialties in nursing that you don't have to be doing the same thing over and over, or all nurses have to be doing the same thing. You know, when you talk about nursing, there is so many areas in nursing that you can go into. So when they say that all nurses do the same thing, that is something that needs to be eliminated as well. Another thing people always say is you must have seen everything in the emergency room, and for some persons, no, that's a no, because you have some persons who definitely never worked in the emergency room, so they're not able to see all of the different, you know, traumas or the dramas that comes with emergency room nursing. Some persons do work in clinics, some work in public health, some work in the communities. So there are different environments that do bring their own emergencies that persons are exposed to. So when you're a nurse, it doesn't mean that you've seen everything, and so it's not wise to approach a nurse and think that, oh, because she is a nurse, she must have seen it. No, a lot of persons are nurses and there are certain things that they've never experienced before, and that is something that we definitely need to have a conversation with the nurse prior to asking for their advice on certain things as well. All right, so that is a misconception we definitely need to address. And the final thing that a lot of persons tend to say is that when it comes on to nursing, it is a stepping stone to something bigger. For a lot of persons, you know, nursing is their ultimate goal. You know, that is their dream career, and it is something that they are looking forward to, or were looking forward to prior to venturing into this role. And so for persons to think that you're a nurse because you're trying to aspire to become a doctor, that is something that a lot of us do not like, because that is not a goal that we're trying to, you know, reach or attain in life. Yes, both professions are really good, but at the end of the day, you have persons who genuinely just want to settle, and it's not necessarily settle for less. You have a lot of persons who just have a passion and a love for just helping persons, and they feel as though nursing is what they will do or excel well in, and that is just what they're doing. So regardless of the profession you're in, just remember that if that is what you want, if that is your ultimate goal, then go ahead and just do your best in that area. So when persons say that, you know, you're a nurse because you never get a chance to become a doctor, or you are trying to get into the, you know, the medical field, I don't really like hearing it, because you have persons who genuinely went into the field of nursing because of their love for it. But if you have any other misconception, or if you want to add anything, go ahead and leave it in the comment box below. And remember, you know, this is a space where we discuss and share information regarding nursing, travel, and lifestyle. So let's just continue with, you know, just pouring out our information here, and we can continue interacting on the channel. Until then, thank you so much for tuning in and making it the Think Nursing channel, and I do hope to see you in the next video. All right, bye.